Hello, I'm Dr. Stephen Durisa. I am Professor of Obstetrics and Gynecology at the University of Rwanda. And today I'm going to talk about introduction to family planning. Our learning objectives are to define contraception and family planning, be able to describe the contraceptive prevalence rates and the global and local unmet needs, identify the benefits of family planning for all women, children, families, and communities, to be able to recognize family planning in the context of human rights and contribution to the Millennium Development Goals, and also be able to describe the common contraceptive methods and the effectiveness. First, we talk about definition, defining contraception and family planning. Contraception is the intentional prevention of pregnancy by artificial or natural means. World Health Organization defines family planning allows individuals and couples to anticipate and attain their desired number of children and the spacing and timing of their birth. It is achieved through use of contraceptive methods and the treatment of involuntary infertility. This is the global current contraceptive prevalence. As you can see on this global map, the contraceptive rates in terms of percentage, the unmet needs or the lowest prevalence are found in sub-Saharan Africa. As you can see on this map, most of African countries and Southeast Asia have prevalence rates of less than 50%. Most of them in sub-Saharan Africa are less than 20%. The current contraceptive prevalence is a biggest problem among women who are poor, a half as likely compared to wealthy women. Living in rural areas is a major factor, less educated and young, especially unmarried women, and more likely to discontinue the methods. So the main factors here is when women are poor, live in rural areas, less educated, and are young, it's the biggest problem. We are going to talk about the situation in Rwanda briefly. The total fertility rate currently from DHS 2014 and Guttmacher Institute reports like the total fertility rate for Rwanda is 4.2. The desired fertility rate is 3.1. So you can see that there's a big discrepancy between the desired and the current total fertility rate. And this gap can only be narrowed by access to family planning methods. And intended pregnancy is reported to be at 34%, and unmet need for contraception is 24.1%. Abortion rate for now 25, induced abortion per 1,000 women, and unsafe abortion of 50%. Maternal mortality ratio is currently 210 per 100,000. As you can see these figures, the gaps and the reduction in maternal mortality can only be fixed or at least reduced significantly by access to family planning methods to all women. This is the situation in Rwanda again. In figure, you can see of all pregnancies in the country, only 44% are planned, and more than 50% of pregnancies are unintended. Of those, 30% are unplanned birth. The rest is induced abortions and miscarriage. Unmet need for contraception. This is whereby there is a need for contraception, but there is no access for contraception. It includes married or unmarried women and sexually active and not desiring pregnancy for at least 2 years or more. If no method is used, then her need is unmet. And usually here when we talk about unmet need for contraception, we are talking about modern contraceptive methods. The unmet need for contraception globally in developing regions, 214 million women want to prevent pregnancy but are not using modern contraceptive methods. 885 million women in developing regions wanted to avoid pregnancies. Of these, 214 million of women are not using contraception. So you can see the gap is huge. 1,600 million women of reproductive age reported to have no access in 2017. This slide shows the unmet need among adolescents. In developing regions, 80 million of adolescent women need contraceptives to avoid unintended pregnancy. Of the adolescents, the unmet need is 60%, compared to unmet need among all women aged 15 to 49, which is 26. So you can see the unmet need is again very high in adolescents, which is 60% versus 26% in all women put together aged 15 to 49 years of age. This slide is very important about the benefits of family planning. It shows family planning saves lives significantly. Sub-Saharan Africa accounts for the highest number of maternal mortality worldwide. When we combine maternal mortality in Sub-Saharan Africa and Southeast Asia, it accounts for 85% of maternal deaths worldwide. As we saw previously in the global map, these are the two regions which has the lowest prevalence rates for family planning. It shows that more women die in the regions where the uptake of or access to family planning is lowest. The next column shows about the lifetime risk for maternal death, which is 1 in 39 in Sub-Saharan Africa, a woman would die because of pregnancy or childbirth related causes. Whereas in Southeast Asia is 160, one woman out of 160. This basically means every pregnancy that you get more than the first one, it increases the risk of dying. And it means that if a woman moves from Sub-Saharan Africa, who had 1 out of 39 risk of dying, and goes to developed countries, her risk becomes so rare that is 1 out of more than 4,000. So it shows that access to family planning is very vital in reducing maternal mortality, and you can see that the maternal mortality coincides exactly with the prevalence of family planning methods. So 94,000 of maternal deaths could be prevented if all women who said they wanted to avoid the pregnancy were able to access them and use them effectively, as reported by WHO, UNICEF, and UNFPA. Benefits of family planning for all women: it lowers the risk of death, as we reported in previous slides. It shows that access to family planning significantly reduces maternal mortality directly. Lower risk of anemia also, poor pregnancy outcomes, complications like eclampsia, preeclampsia, and other outcomes of pregnancy. 17 to 30% of maternal mortality from unsafe abortion can also be reduced when women access family planning. There's also non-contraceptive benefits from some methods, such as protection from disease transmission or certain cancers and other gynecological problems that could be benefited from use of family planning. Also, access to family planning in general improves education and economic opportunities for women. For children, it goes without saying that when women use family planning methods, the spacing is improved, which includes longer breastfeeding. Longer breastfeeding is so vital for women that it provides nutrition, protects kids from childhood diseases, and improves mother-on-child bonding. It reduces child illnesses and death, and also allows more time and resources for parents to meet the needs of such a child. The benefits for the family and the communities: families can devote more resources to providing for each child, and it reduces maternal and child illnesses, improved economic strains on families, and maternal death. and relieves economic, social, and environmental pressure. And it enhances women's status and promotes equality between men and women. Family planning is also human rights. It goes without saying that access to family planning is access to human rights. ICDP reports that all individuals and couples have the right to decide freely and responsibly the number, spacing, and timing of their children, and to have the information, education, and means to do so, and the right to attain the highest standard of sexual and reproductive health. It is also common knowledge now that family planning is at the center of Millennium Development Goals, MDGs. It directly impacts MDG 4 and 5, improving maternal and child health, but also indirectly related to the rest of MDG. This source from United Nations 2000 shows how family planning affects the rest of MDGs. These are contraceptive options and their effectiveness as in the order of their effectiveness. We have the highest one, which is implant, IUDs, female sterilization, vasectomy, with the highest one effective, which is less than 1 pregnant per 100 women. And in the order, we show the lowest, including the natural methods of family planning. So if we want to increase the family planning uptake, we also have to encourage women to use modern family planning, especially the long-acting. So contraceptive effectiveness, we also want to show the percentage of women experiencing an intended pregnancy within the first year of use. You can see combined pill, the patch, the ring, and so on. There's a huge difference between the typical use and perfect use. We also have to put more energy and emphasis on training. As you can see, there's a big difference between the typical use and perfect use. The typical use is usually most of the methods less than 1%, but in perfect use is usually less than 10%, but typical use goes up to 8 in most cases. So we have to put more emphasis in using the long-acting methods, which narrows the gap between the typical use and perfect use, and all of them are at least less than failure rate of less than 1%. These are the strategies to improve contraceptive efficacy, as we said, is improve education on proper use, which is significantly affect each method, as we saw, and the use of long-acting methods like implants and IUDs. In summary, the benefits of providing family planning services, it allows women and couples to delay, to space, and limit pregnancies. This would help to achieve the healthiest outcomes for women and their children. And this eventually would improve the well-being of families and communities. Family planning services are most effective when clients are free to make informed choices. Thank you very much.